how the kidneys are examined. How the kidneys are examined. This is one example here. Our flickering strobe light over here is another example. And then this is just a little bit different part of the urinary tract examination. Plain film is not very good with kidneys, ureters, and bladder. Urinary tract. It's not good at all. We can see kidneys faintly, and so we can tell a bit about their size and their position, if they're normally positioned and if they're big. Calcifications, of course, in the collecting system, stones, show up very easily because they usually have enough calcium in them to be visible. But otherwise, the urinary tract is not very well examined with plain film. So we can examine it in different ways, depending on what one is looking for and trying to see. If it's a collecting system issue, renal pelvis, calyces, ureters, then it's best examined with contrast. And there's two contrast exams, this one and that one, which are two different contrast exams based on kidney function. If the kidney is still working, then the exam that can be done, which is a relatively easy exam, is called an IVP, which you may have heard. IVP stands for intravenous pyelogram, intravenous pyelogram, which is a functional exam for the collecting system of the kidneys. The kidney has to work in order to do an IVP. And so you can see here, see the collecting system? Pelvis, pelvis, major, 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 minor, minor, tip of the papilla, the papilla, which should be concave. There's the ureters going down. Beautifully normal. But see where it says 8 minutes? That's an 8-minute film after the contrast was injected into the individual's arm. That's 8 minutes. And the kidney filters the contrast material. And it filters it that fast. That's an 8 minute. That one's 4. Look at how the collecting system in 4 minutes. It's actually pretty astounding how fast your kidneys filter your blood. It's really amazing. Because a bolus injection here, within less than 60 seconds, the kidneys will start lighting up. That's how fast they're filtering the blood. In 60 seconds, it's starting to contrast enough. The kidney would start to blush and light up on the collecting system. Measure how fast it does it. If the kidney doesn't work, then they can do this exam, which is an invasive exam. This requires catheters. So they have to go in through the urethra, up into the ureters with catheters, and then inject contrast backwards into the collecting system. And this is done if the kidneys are insufficiently functioning, which they were in this individual. The calyces are kind of distorted and twisted and pulled, and this is probably chronic pyelonephritis. Patients have chronic parenchyma infection. This is called a retrograde pyelogram. Retrograde. You can see the catheters in there. Retrograde pyelogram. So an intravenous pyelogram is a functional exam. The kidneys have to work in order to do that. And you can see the gallbladder here. Mm-hmm. They tried to do an intravenous pyelogram. If the kidneys can't excrete the contrast from the blood, the liver will do it. But it takes longer for the liver to do it. And then it ends up in the biliary system in the gallbladder, and what's the gallbladder do? Concentrate it and collects it, and it'll go out through the GI tract. So they tried to do an IVP in this patient, insufficient kidney function, and there's the contrast in the gallbladder, which would have been normally excreted by the kidney. And this one is what's called a voiding urethrogram. You can see the contrast here. There's the prostate. See where it narrows the urethra? And then this is the penile part of the urethra right here. That's for examining the lowest part of the urinary tract, urethra. And actually the patient whizzes during the exam. That's why it's called a voiding urethrogram. Voiding urethrogram. So this is how the collecting system is examined. Kidneys can also be done with CT. If it's more of a morphology issue, shape, kidneys, cysts, things like that can be done with CT. Ultrasound's also good with the kidney. But for the collecting system, contrast is the best. Yeah.
So what position is that patient in? Because one of the,
This is an oblique.
okay.
Yeah.
Straight and the other
Yeah, it's oblique. And actually, you get a really good look at the SI joint better than this one. And you see the obturator really clear. So the patient's actually just oblique a bit.
other side.
Yeah. Okay?